Good morning. Today's class topic is the facial nerve, cranial nerve number 7. So, this is one of the very important cranial nerves as it is a mixed nerve, which means we have both motor and sensory components involved in this cranial nerve. And as the name suggests, it is a very important nerve for the supply of the face. Now, to discuss and as of every cranial nerve, we begin with the origin and the functional components, and then we go on to its course and distribution and branches. With a note on the applied aspect, we should be able to get a comprehensive idea about the facial nerve. And let us begin. So, the facial nerve is the seventh cranial nerve, and it is also known as the nerve of the second branchial arch. So that means it is supplying many of the structures that have developed from the second pharyngeal arch. And we can see, as we mentioned, it is a mixed nerve which will have both motor and sensory fibers. So coming to the sensory nerve, which is also called as nervus intermedius. Now, that is because when we see the uh, course, we will see why it is called so in its uh, course of exit from the brainstem. Now, functional components. The important functional components involved here are the special visceral efferent, which is supplying the muscles developed from the branchial arches. In this case, we have already mentioned it is the second branchial arch nerve. So therefore, the second pharyngeal arch muscles that are developed. Then general visceral efferent, which is another motor component. As we see very clearly, it is the parasympathetic component supplying secretomotor fibers to the submandibular and sublingual salivary glands, the lacrimal glands, and the other glands of palate, pharynx, and nose. The remaining sensory components we can see are one is special visceral afferent. So therefore, it means it is supplying the special sensation of taste or taking the special sensation of taste from the tongue and the anterior two-third of tongue to be specific. The general somatic afferent, which is again supplying or taking sensations from the skin of the external ear. So that is general somatic afferent. And then the last one will be the general visceral afferent, which is sensations which are coming from the soft palate. So these are visceral sensations and therefore from the soft palate. So these are the functional components, special visceral efferent and general visceral efferent, two motor components and three sensory components, that is special visceral, general somatic, and general visceral. Now, these functional components are supplying or the origin of these nerve fibers, cell bodies are in the nucleuses that we see situated in different parts of the brainstem. Most of them are in the pons. The motor nucleus, that is the special visceral efferent, which we said is a branchiomotor. Then the other efferent nuclei are the superior salivator nucleus and the lacrimatory nucleus. So these both are for the parasympathetic components of the salivary gland and lacrimal gland. Then the sensory components that are involved here are seen in the nucleus of tractus solitarius, which will have both special visceral and also a part of it is related with general visceral sensations from the palate and the special visceral from the tongue, as we saw. And then the general somatic efferent component is related to the spinal nucleus of trigeminal nerve, which is extending from the medulla onwards and in the pons and as well as the upper part of brainstem. So these are the nuclei that are related for the fibers of facial nerve. Two functional components supplied through three nuclei, that is motor nucleus, the main or the chief motor nucleus, the superior salivatory nucleus, and the lacrimatory nucleus, which are the parasympathetic secretomotor fibers. And then the sensory are through the nucleus of tractus solitarius and spinal nucleus of trigeminal. The uh, cerebral influence is, of course, from the primary motor area, which will be influencing, or which is the main area for voluntary control of the muscles in the body. Uh, and therefore, we will have the corticonuclear fibers coming from this cerebral cortex, which will have an influence on the nuclei that we just mentioned, especially the motor nuclei, in this case, the branchiomotor nucleus. And therefore, you can see that there is influence for uh, the facial motor nucleus in two ways. That is, there is influence from the same side cerebral hemisphere, and there is also influence from the opposite side cerebral hemisphere. So that will be the explanation for seeing different types of symptoms in the facial nerve lesions. We have upper motor neuron lesions and lower motor neuron lesions, which will show different signs and symptoms due to this cerebral connections. Now, let us go into the course and relations. Now, the intracranial course, as we mentioned, already we said it starts from the nuclei in the pons. Most of them are in the pons. So, from these nuclei, the facial nerve will come and will be seen coming out as a nerve. That is, a motor nerve will come out from above the olive, that is in the pontomedullary junction. And then we can see just lateral to that will be the sensory root. And that is what we call a sensory intermedius. And then lateral to that, we can see the eighth cranial nerve. So the sensory nerve is seen between the motor and the vestibulocochlear. Therefore, the name sensory intermedius nerve. So it is lying between the motor root of the facial nerve and the vestibular cochlear nerve, which is going through the same pontomedullary junction or the groove. So that is the reason for the nerve name sensory intermedius. Now we can see in this slide the diagram showing the nuclei and the way the fibers are coming out of the pons. So we can see the motor fibers are winding around the abducen nucleus before it comes out of the pontomedullary groove. And along with that, we can see the secretomotor fibers coming from the superior salivatory nucleus, shown in green here. And the lacrimatory nucleus fibers also will join with that. And then we can see these blue columns, which are denoting the sensory components. And that is giving rise to the sensory root. So the sensory root and the motor root comes as two individual roots as it is coming out of the pons, or as it is seen in the pontomedullary junction. So at the initial part of this cranial nerve, it is separate as motor root and sensory root. But as we see further in the intracranial course, we will see that the both the motor and sensory root will enter the petrous temporal bone through the internal acoustic meatus, along with the eighth cranial nerve. And then we will see the nerve passing in relation to the middle ear. Now, that is an important relation when we talk about the middle ear relation. So in the middle ear, we will see that it will have, as we said, initially entering as two roots, but then the motor and sensory root will unite as a single cranial facial nerve. And that is what enters then as the facial through the facial canal. And then in the facial canal, it is passing in relation to the middle ear. So first it is seen in very close or passing above the vestibule of the inner ear, and then it will pass on the medial wall of the middle ear, and then it will be seen passing through the posterior wall, which we call as otherwise the facial canal, and then it is passed out of the petrostemporal bone through the stylomastoid foramen. So that will be the end of the intracranial course. And from the foramen onwards, we will call it as the extracranial course. So this is the intracranial. Now coming to the extracranial, from the stylomastoid foramen, the nerve will come very closely superficial to the styloid process, and then it will enter into the parotid gland through the posterior border, and through the in the posteromedial surface it is passing through this parotid gland, and it will diversify into its 5 terminal branches, and thereafter we will see the 5 terminal branches which will be coming out of the parotid gland, supplying the muscles of the facial expression. Now, branches and distribution. The important branches that we see within the facial canal, that is within the petrostemporal bone, or as it is passing through the ear or middle ear, and the we will see a greater petrosal nerve coming out. We will see a nerve of to the stapedius muscle coming out. So these are important branches coming out while it is in the facial canal. And the very most important chorda tympani nerve, which is a sensory nerve, taste sensation from the anterior two-third, and also it is carrying the secretomotor fibers to the glands, the salivary glands, submandibular and sublingual. And then as the cranial nerve exits from the stylomastoid foramen, we will see the remaining branches. We will see branch immediately coming out as it's coming out of the side, that's called the posterior auricular. And then we will see another branch which is going to supply the posterior belly of digastric muscle. And a small branch going to the stylohyoids. After that, we will see the nerve going through the parotid gland. And in the parotid gland, as we mentioned, it will mostly divide into 2 trunks: an upper trunk, which will have temporofacial and temporozygomatic branches. So the cervicofacial, which will then diversify into 3 different branches, that is buccal branch, marginal mandibular, and cervical branch. So these are the 5 terminal branches which exit from the parotid gland. In some cases, the buccal branch may have an upper buccal and a lower buccal nerve. So this is a diagram which denotes the course and distribution, course and relation as the facial nerve exits from the pons, passes through the middle ear or on the walls of the middle ear. There is a ganglion which we also call as a geniculate ganglion, as it is passing from the to the medial wall, and then you can see the other branches which are coming out of it. So the distribution, the greater petrosal branch or nerve, which we said coming out of the facial canal as it is in the middle ear, it is going to join with the deep petrosal nerve, which is carrying sympathetic fibers. So the greater petrosal is carrying parasympathetic fibers, and together they will form the nerve of the pterygoid canal. And these are the ones which are going to supply the secretomotor supply to the lacrimal gland and the nasal glands and the glands on the palate. So nerve to stapedius is a purely motor nerve. This is going to supply only the stapedius muscle in the middle ear. Chorda tympani nerve, this is an important nerve. As we said, it is a nerve which is carrying both secretomotor as well as sensory fibers. The sensory fibers are from the tongue. Now this chorda tympani nerve thereafter, as it is coming out of the middle ear, it will exit the middle ear through the posterior canaliculus, and then it has to join another nerve which is called the lingual nerve. So then only it will be able to reach to the tongue and the other oral structures that it has to supply. So it passes through the posterior canaliculus and then comes out of the middle ear through the anterior canaliculus. After it exits the anterior canaliculus of the middle ear, it is coming out of the skull through the petrotympanic fissure. So the cranial exit of the chorda tympani nerve is the petrotympanic fissure, and from there it will then join to this lingual nerve, which is a branch which we have seen of the mandibular nerve, one of the important branches in the posterior division of the mandibular. So it joins the lingual nerve, and that is through the lingual nerve, these fibers, the sensory fibers from the tongue will be carrying the taste sensations from the anterior two-third, and the secretomotor fibers will go to the submandibular ganglion, and from there it will supply to the submandibular and the sublingual gland. So that is about the chorda tympani, and the uh, remaining branches, which one of the branch which comes out immediately as it exits from the stylomastoid foramen is the posterior auricular. Now, this is a motor nerve which is there to supply the muscles that we see in the scalp. Also, the occipitalis muscle, which is seen in the scalp. The posterior auricular muscles, which are related to the facial muscles around the ear. So, digastric branch is there to purely supply the posterior belly of digastric, to be specific. It is the posterior belly of digastric, whereas anterior belly is supplied by another nerve. Now the posterior belly. Then the stylohyoid branch, as the name suggests, supplied the stylohyoid muscle. So these are the nerve branches which are coming before the parotid gland. Then all the terminal branches which are passing through the parotid gland, the temporal, zygomatic, buccal, marginal mandibular, and cervical branches. These are the branches which are going to supply all the muscles of the facial expression around the eye, around the nose, around the oral, all these facial, including the platysm. So these are the branches which are to supply all the muscles of facial expression. So that shows how important the cranial nerve seventh is because of its distribution to all the muscles of facial expression, to the submandibular and the sublingual salivary glands, to the lacrimal gland, to the other muscles that are seen in the ear, that is the stapedius muscle, then the other muscles which are seen on the scalp, in the muscles around the ear, the muscles of the posterior belly of digastric, the muscle of the stylohyoid. So these are showing the importance of the distribution of the cranial nerve 7. Now, as we mentioned, the most common applied aspect is the facial nerve palsy. As we see, there is upper motor neuron lesion and lower motor neuron lesion. In the case of upper motor neuron lesion, the opposite side facial muscles are paralyzed, but the difference is that it is including both upper and lower quadrants of the face of the opposite side. Whereas in the lower motor neuron lesion, we will see the impairment is of both upper and lower muscles of the facial opposite side and the same side. So this is the applied aspect with regard to the uh, facial nerve palsy. The facial nerve lower motor neuron lesion is also commonly called as Bell's palsy. So Bell's palsy is also the most common sign showing the deviation of mouth to one side. So all the muscles of the facial expression of that side is paralyzed. So this is the importance of facial nerve. There are other symptoms like crocodile tail. So the importance, I hope you could understand, with regard to its origin, is coming from 5 functional components and nuclei. And then the distribution we saw is to the facial muscle expression, muscles of facial expression, the salivary glands, and the taste buds. So hope you could understand the importance of this cranial nerve. And with this, we come to the end of this session. Thank you.